as part of the pre-op preparation. With the benzodiazepines, there's short-acting benzodiazepines like Ativan, or lorazepam is the generic, or short-acting Xanax or alprazolam. And then there are long-acting benzodiazepines such as clonazepam or Klonopin, or diazepam or Valium. And now there is a long-acting Xanax or alprazolam called Xanax XR or alprazolam ER extended release, or XR extended release. One of the problems with short-acting Xanax is that it's so short-acting that when it wears off, it precipitates rebound anxiety. As it's leaving a person's blood system, the rapidly falling blood level actually precipitates withdrawal anxiety, which then makes the person feel like their anxiety is escalating and they need to take another dose, when in effect what really is happening, the rapid wearing off of the effect of the Xanax is actually what's causing the anxiety, and it's kind of a withdrawal anxiety, and then the person takes another dose. One of the traps with Xanax is that the short-acting is very fast onset, so people really feel it kick in, and they like that feel, and they can tell it's working, in contrast to the longer duration action of clonazepam or diazepam or Xanax XR, which is more gradual in onset but maintains a constant blood level, so it's in the system all the time, and actually is more effective in the long run at maintaining a barrier against the anxiety, but you do not get the kick or the hit feel that you do from the short-acting Xanaxes. And there's a trap then that people like the feel of the onset of the short-acting Xanaxes, and feel like some of the long-acting ones aren't working as well, but then get caught in the trap of the short-acting ones wearing off and having rebound anxiety, mistaking that for their baseline anxiety, and getting into the cat chasing its tail syndrome of then taking another Xanax when the short-acting one is wearing off, and then when that one wears off, taking another one, and then another one, and then another one, and before long, tolerance is developed and the dose goes up and up and up, just like can occur with the opioids, the tolerance and dependence syndrome. So the abuse potential is much higher with the short-acting benzodiazepines. Neurontin and Lyrica, which are often used for pain syndromes, also have anti-anxiety effects. In fact, Lyrica or pregabalin has been shown to have as good or even potentially better anti-anxiety effects than the benzodiazepines. There's some abuse potential with Lyrica, although much less than with the benzodiazepines. It does place Lyrica as a Category 5 controlled substance as opposed to a Schedule 4. And you do have to watch for the potential for abuse, but it's much less likely than with the benzodiazepines. The antidepressants in the SSRI category, the selective serotonin uptake inhibitors, and in particular Celexa, Lexapro, and Paxil, and even Zoloft, are utilized for their anti-anxiety effects independent of their antidepressant effects. Zoloft maybe even more so for post-traumatic stress disorder, but say Lexapro and Paxil for generalized anxiety and panic anxiety, for reducing the generalized anxiety and for helping to block recurrent panic attacks. Then there's Buspar or buspirone, which works on the dopamine system, to block the dopamine system, which is slower in onset. It has to build up in your bloodstream and has to be taken over days or even a few weeks before it actually works. And so people are less patient in taking that one. It does have some side effects on the stomach, and so some people just don't tolerate it. So between it having adverse effects on the stomach and being slow in onset and people having to be patient with it, it sometimes is difficult to get people to hang in there and try that one adequately to see if it's going to work. And then finally, well, there's two more. There's Effexor, which is a SNRI, serotonin norepinephrine reuptake inhibitor. Differs from Celexa and Lexapro, Paxil, and Zoloft in that, in addition to blocking the reuptake of serotonin, it also blocks the reuptake of norepinephrine. And at low doses, it's really no different than the other selective serotonin reuptake inhibitors, but as the dose gets raised and the dose is higher, it kicks in that selective norepinephrine blockade, and that gives it an anti-anxiety effect. And so something such as Effexor or venlafaxine is also can be helpful in treating anxiety disorders. Then finally, there's hydroxyzine or Atarax, which has an antihistamine effect and is used as a mild tranquilizer. It doesn't have addictive side effects. It does have some sedation side effects, and some people do respond well to that for their anxiety. Other people report that it makes them tired, or it doesn't do much. Their anxiety is way beyond the ability of that to help. In